Good evening. This is Straight Talk with Eugene Chan. Is Hong Kong ready for the next pandemic? What a better time to talk about this than the present as we emerge from COVID. And to help us with this tonight is leading expert in infectious diseases, Professor Ivan Hong. Professor Hong is chair professor and head of the Division of Infectious Diseases at the University of Hong Kong. He was on the front line during both the SARS outbreak and was one of the public faces of our COVID vaccination campaign. He is a world-leading expert in the field of antiviral and vaccinology. And with both his extensive expertise and first-hand experience in this area, he will help us reflect on Hong Kong's COVID journey. Welcome, Ivan.
Good evening, Eugene.
I read that you have received the Anti-SARS Gold Badge Award from the Hospital Authority as a frontline medical officer. So I will start by revisiting the SARS pandemic that was in 2003, which is like 21 years ago, which lasted for 3 months, infected about 1,700 people and killed nearly 300 people, and also shut down Hong Kong at that particular time.
Yes.
So quite a significant impact on Hong Kong. So how did Hong Kong fare in dealing with SARS when they compare with other regions in Asia and the world at that particular time?
I think for SARS, it's more like an epidemic, so very much a regional thing. So Hong Kong is badly affected, mainland is also badly affected, and then of course there are scattered patients or cases in Canada, in Singapore, in Vietnam, in other parts of the world. But I think in Hong Kong that is a very important experience that we have in actually preparing for the next epidemic or pandemic that of course happened 20 years later, which is the COVID. And again, during that time, we did, I think, pretty well. In fact, at that time, we did not have any isolation facilities. We don't have negative pressure facilities. We didn't have vaccine or antiviral. So we were treating the patient and putting them into single room and supporting them with the ventilatory support. But we were actually one of probably the first team in the world to isolate the SARS coronavirus as the cause of the SARS.
Right, Professor. When you say that Hong Kong were, I would say we've done fairly well. Do you think it was because we are particularly more vigilant, or the public awareness, or cooperation within the community? What kind of helped to contribute to this sort of not to such a bad outcome?
I think in terms of SARS is that we were very vigilant. We were also trying at the very beginning to find the cause of SARS. And of course, with several important leaders at that time, including Professor K.Y. Yuen and Professor Molly Pierres, we were able to isolate the virus at the very beginning. Because once we isolate the virus, we're able to have a diagnostic test that will able to help us to diagnose and confirm the patient with that infection. And hence we're able to isolate the patient and stop them from spreading.
Yeah, I can still remember with like close to 300 fatalities at that time was very alarming at that particular time. Yes. But when I said relatively small numbers, is when I compared to the recent the COVID-19 that we had. So do you think it was it luck that we had, or you think it was all hard work that helped to keep
it was all very
number?
hard work. I think it was the hard work of all the frontline medical staffs, including doctors and nurses. We were very alert from the beginning, and everyone was very vigilant. We were wearing N95 masks and protective gown at that time. And I think the government did extremely well in that situation. Right. And hence, we were able to contain the spread of the virus very quickly, isolate the virus, and of course, we did develop some kind of repurposing antiviral treatment towards the end of the epidemic. And of course, very fortunate the epidemic come to an end, even though at that time, I think the mortality rate is still about 10%, which is very high.
Right. When you said that our experience in SARS gave us a very good foundation in the combat against COVID, if you want to isolate, identify a few factors, what would be the main things that we have learned from dealing with SARS that gives us such a good foundation when we deal with COVID?
I think the experience that we have from SARS, most important is there are several aspects. The first will be that we were able to form the Center of Health and Protection. That is one of the most important things, that we're able to liaise very closely with the WHO, the US CDC, and the Chinese CDC. Hence, we're able to get the first-hand knowledge in terms of these emerging infectious diseases. Second thing, very important, is that in each of the hospital clusters, including, of course, the infection center at Princess Margaret Hospital, we're able to have at least 20 to 30 negative pressure facilities or negative pressure rooms that we're able to quarantine our patients. And of course, in Princess Margaret, they have up to I think 200 beds of negative pressure facilities, which we were able to control right from the beginning if we have another epidemic or pandemic.
Right.
And then, of course, other things, including we're already developing in our research in terms of antivirals and also in vaccines. So these are the things that help us to combat, the subsequent epidemic and pandemics.
Yeah, I can still remember at the beginning of the outbreak, Hong Kong, I would say, used to turn relatively unscathed by it because we had quite a flat epidemic curve than other places, which is quite remarkable, being an international transport hub. And we have we're so close to the mainland, as you just mentioned, that we have millions of mainland visitors annually, that we have made us more vulnerable because there are more people coming in and out. So all that helped us to sort of maintain a very flat curve in the beginning.
Very much so. I think we actually did very well at the beginning, especially I think before the fifth pandemic that happens in early 2022.
Yes.
We have, I think, before that, we have one of the lowest mortality and the lowest number of cases in the world. I think at that time we have around just 200 deaths. Mm-hmm. And in terms of confirmed cases, we have around maybe just 15,000,
right,
which is a very small number compared to other places. I think we did even better than Singapore at that time.
Right. So do you think, I can still remember all those scenes of, daily lives coming out right in front of my eyes. It's like people wearing a lot of sort of a wide adoption of wearing masks and all that. Do you think that was instrumental, since you mentioned that?
Yes, I think that is instrumental. And I think that is because of the experience that we have from SARS, that basically the whole community is very aware, and hence right from the very beginning in Jan 2020, the entire Hong Kong community already very vigilant, already wearing masks and already having some diagnostic kits already available. We also starting doing nasal swab, which we have a very, very good easy way to sample and make the diagnosis, and hence we are able to pick up the cases very early on, and starting maybe 1 or 2 days from symptom onset, and hence we're able to quarantine them very quickly. Mm-hmm. We actually quarantine every single patient at that time, right, and hence stopping the virus from spreading among the community.
Right. Apart from those mask wearing, also we have adopted quarantine measures and tightening screening at border stations. I'm sure that all helped. And I still remember on the 25th of January, Hong Kong government declared the viral outbreak as an emergency. Yes. We are one of the highest warning tier, that we were quite early compared to other countries. And I remembered all those amusement parks like Disneyland and public museums and sports centres and schools were all closed, and even government servants were starting to work from home.
Yes.
Was all that a wise move at that particular time?
Yes, I think it was one of the best moves, and I think that actually helps in containing the spread of the virus, and also minimizing the number of patients who have been hospitalized, and hence allowing us to focus on treating these very severe cases. And I think already at that time we did have some repurposing antiviral treatment with interferon and ribavirin, Kaletra, all these kind of antiviral that is effective, and also later on remdesivir against the SARS-CoV-2. So we did have antiviral to treat our patient at that time, very strict right from the beginning.
Right, yes.
And we already have a design and clinical trial in Jan already. So we were probably one of the earliest places to have this kind of treatment, quarantine, from diagnostic to quarantine to isolations to treatment. Basically, the whole management plan ready, available right from the beginning.
And when you mention all those terms, all those names coming about all over my mind is such as we had the Home Safe app as well.
Yes, indeed.
And also, one thing that we must be very grateful is that at SARS, like 20% of the healthcare workers were infected.
Yes.
I think we had a much better performance with our healthcare workers at COVID, isn't it?
Very much so. I think we have very, very few, probably at the beginning, close to zero, nosocomial, that means hospital infection. Even, I think, for healthcare workers, most of them had the infection from the community.
Right. Okay, Professor, let us take a break now. But viewers, stay tuned. We will be right back for more discussion on how ready is Hong Kong for the next pandemic. Thank you for staying with us on Straight Talk. We have been reflecting on our SARS experience and how that has helped Hong Kong to combat COVID-19 in the initial phases. So, Professor, thank you for sharing with us your recollections of what happened and telling us that we have done very well with the SARS experience. I mean, sort of joint effort by Hong Kong people, the government, healthcare workers, and all of you guys, of course. Thank you very much for keeping things very well controlled right at the beginning. I think everything kind of went sort of a bit of out of control as soon as the Omicron or the fifth wave comes. And I think the infection, as you said, was pretty low, and we jumped to like 10,000 cases a day. Our healthcare system was really stretched, and many of our elderly died, and we end up with over 10,000 deaths by the end of 2022, including my father and some of many close relatives and friends. So what actually happened that with such a good background of preparation and experience and reassurance from all of us that we're doing well compared to the rest of the world, what actually happened?
Well, I think the major pitfall is basically happened towards the end of 2022, is when we actually launched the vaccination program in mid-2021, and it actually went pretty well. The only problem, of course, is that there are misinformation about the vaccine. People worry about the side effects of the vaccine, especially among the elderly people. And the problem, of course, is that we had a very good vaccination rate apart from our elderly, which is probably the most vulnerable. And those elderly, majority of them are in elderly homes. So if you can imagine, if there's a major outbreak happening in the elderly homes, you could see that the virus could spread very quickly because the environment they are living in, and that is probably contribute to the subsequent so-called rapid rise in the number of cases and ending up with a relatively high mortality at the end of the so-called 2022. And that happens is probably one of the single case of Omicron have escaped from under the quarantine, and because of the Omicron is very much like airborne transmission, so it could spread very quickly, and just one single case or one single patient subsequently leading to many cases at the end of the day. And the problem, of course, is the elderly people who have not been vaccinated. We understand that actually for those who have not been vaccinated had a much higher mortality rate compared to the others who have received 2 or 3 doses of the vaccine, regardless of what vaccine you take. Right,
Professor, since you mentioned the side effects of vaccine, I can still hear stories during casual conversation that, I didn't take a vaccine, I wasn't infected. Oh, you look at all those people who had vaccine, subsequently had developed all these side effects. So are those factual, or are they just myths?
They're all myths. We do have some side effects of the vaccine, but the interesting thing is that when we did the subsequent the research or the surveillance, basically the whole population surveillance by the University of Hong Kong, of course. And we find that basically the side effects, especially among the elderlies, are actually fewer compared to young people. Because the young people immune response is much higher compared to the elderly. So that's why the elderly, in fact, even if they're receiving the mRNA vaccine, they have very few side effects. But the importance, of course, is the benefit of the vaccine is far outweigh those minor side effects. And if you received 2, especially 3 doses of the vaccine, you have a very, very good protection against severe disease.
Right.
And the protection, the efficacy is above 90%. So that is so important that, for the elderly people, they need to get the 3 doses of the vaccine. But unfortunately, because of side effects, all these myths, elderly people, especially in the elderly homes, they refuse to get vaccinated, especially during that period of time. And if you look at the vaccination rate, we had a very good vaccination rate. We have above 92, 93% among the whole population.
Yes.
But if you look at those above the age of 80, the vaccination rate, even up to now, is still running around 75%, which is not enough.
Right.
And that probably is the reason why we have such a high mortality in the 5th wave. And again, because we had a very high elderly population, probably one of the highest in the world.
Right. Professor, since you mentioned all those factors, were you guys anticipating such a sort of widespread infection from the Omicron? Because we know that there have been very contagious, infectious in other countries.
Yes.
Could we have done better in hindsight?
Yes, I think definitely we could have done better. We are anticipating an outbreak already, end of 2022, for the Omicron. We know that it's coming, but we underestimate that it could spread so quickly. And I think what we could have done better, already, of course, by the end of 2022, we already, strongly advising, the government to perhaps try to increase the vaccination rate among the elderly homes. And I think the government already responded very well. They actually tried their very, very best in trying to vaccinate the elderly at that time. But unfortunately, it comes too quickly.
Right.
And I think in hindsight, we probably could have done better is by more, perhaps we might need to a certain extent, we might need to not actually forcing them, but to whatever way that we should able to convince them,
right.
Especially in the elderly homes, to get vaccinated.
Right. Ivan, you were the co-convener of the Expert Committee on Clinical Events Assessment following COVID-19 immunization.
Yes. Any
insights that you can share with us?
Yes, I think we actually did, we worked very hard. My other co-convener, Dr. Scaly, so both of us have been working very hard from the beginning. I think in the mid 2022, 2021 already, we are actually, once the vaccination program was launched, we already spreading every week with the media and explaining in details that both vaccine platforms are very safe.
Right.
And that we do have some kind of so-called mortality after vaccination, but these are actually due to patients who already have very critical disease.
Right.
And that when you have a mass vaccination, you will have come to so-called mortality, but this mortality is not associated with the vaccination. Is that whatever happened, whatever they have, maybe they have a flu illness, they have a flu vaccine or whatever, these individuals are likely to have these complications anyway.
Right. Yeah,
so we're already spending time explaining in details to the population.
Yeah, thank you for a very detailed sharing of what your thoughts are. One thing I think I'm sure the viewers are going to like to know is Hong Kong is one of the very few countries that sort of adopt a zero COVID elimination strategy. Yes. And we had one of the longest hotel quarantine in the world. However, it didn't really protect us. And and we had actually had a significant impact on our economy. In hindsight, will you use the same strategy? And also, was it all worth it when you look at it?
Yes, I think the so-called zero strategy is actually worked very well at the beginning. Because before the time when we had an efficient antiviral or when we have a vaccine available, we need to have a very close surveillance and so-called quarantine and try to minimize the spread of the virus in the community. But when you have vaccines and antiviral available, then we need to change.
Right.
The policy need to change. So I think, on hindsight, I think when you have a very good vaccination rate and when you have a very effective antiviral, I think is the time of changing from the zero policy to gradually opening up will be very important.
Right.
So the timing of the change, perhaps I think we could have done better.
There's something that we have learned.
We could have done earlier.
Yeah, Professor Les, we are now at the final part of the show. Time has gone very quickly, and I'm sure people want to know more. But most importantly, it has been said that it's not a question of whether that we're going to have another pandemic,
Yes.
but when. I'm sure you will agree to that. So what factors will trigger that, and when would that be?
It could happen anytime. In fact, emerging viral infection could be happening maybe in a few years, and it's happening all the time. But the important thing, of course, is the surveillance. I think very important is that you need to survey for these emerging infectious disease and be prepared for the next pandemic. So I think if you have very good surveillance among both the animals and among the human, and then you prepare in every front in terms of vaccine, in terms of antiviral, that will be very important.
One final question. Are we ready for the next pandemic, and what can we do to protect ourselves?
Yes, I think we are very much ready for the next pandemic, and already we're setting up, with the HKU, the Global Pandemic Surveillance Alliance, and also with Singapore, with US, with mainland China, and also we have another is the vaccine, International Vaccine Institute, developing vaccines, and also probably antiviral to tackle these. Okay. So I think we are very much ready for the next pandemic, but we still need to work hard on the research.
Right. Thank you, Professor Hong, for helping us to reflect on Hong Kong's experience with COVID and SARS, of course. While there have been success, there are ongoing challenges. We certainly need to learn from our experiences and prioritize collaboration and innovation to be ready for the next pandemic, as Professor Ivan Hong has suggested. Quote for this evening: prepare and prevent, don't repair and repent. Let's stay vigilant and united in our efforts to build a healthier future. Have a good evening and see you next week.